The Edo State Primary Healthcare Development Agency, under the leadership of the Executive Secretary, Dr. Kosin Oamiri, on Tuesday held a stakeholders meeting to strategize on a campaign against the MPox virus. The meeting brought together key stakeholders from the healthcare sector, including government officials, healthcare professionals, and community leaders. The primary objective of the meeting was to develop a comprehensive plan to prevent and control the spread of MPox in Edo State. The stakeholders discussed various strategies, including public awareness campaigns, vaccination programs, and enhanced surveillance and reporting systems.
Edo State has about 2,500 vaccines in general. And as she said, there are going to be two rounds. The first round is anytime we're starting this week. We'll start this round this week. After 28 days, that's after 4 weeks, we are going to go for the second round. It is only once someone has 2 complete rounds that is when the person is vaccinated from the MPox virus.
Safe and free. It is beginning of the hand because it is given intramuscular movement. So at times you might have weakness of the hand, which will just last for maybe 12 to 24 hours.
The Director, Disease Control and Immunization, Edo State Primary Healthcare Development Agency, Dr. Eseigbe Efeomo, says that the MPox vaccine is aimed at the target populace within the state, while praising the support of the federal government, WHO, and UNICEF for their support.
The meeting we're having here is a stakeholders meeting before the introduction of the MPox vaccine. Now, the MPox vaccine is being administered in Edo State, amongst other states in the country, because Edo State is one of the states where the MPox outbreak has occurred, and it's previously known as monkeypox, and it's caused by a virus. So this vaccine is to ensure that people at risk, especially healthcare workers and those who are immunocompromised, do not come down with the MPox. So, and this vaccine, we're receiving support from the federal government, from WHO and UNICEF, and as well as the state government, to ensure that this vaccination gets to the target population that I've earlier mentioned, the healthcare workers and those who are immunocompromised. So with these vaccines, they will be protected and will not come down with the MPox.
The state health educator, Edo State Primary Healthcare Development Agency, Mrs. Irene Uwabo, says the local government in which the MPox vaccination will be taking place includes Ego, Oredo, Ikpobaoka, Ovia Northeast, Esan Northeast, and Esan West. One of the participants, Mr. Muta Abdullahi Babatunde, speaks on the purpose of the meeting and on the trust of the MPox vaccine proposed to Edo State.
We're talking about the MPox vaccination. This is to ensure that our stakeholders, our relevant stakeholders, are aware of the upcoming MPox vaccination in the state that is going to take place in 6 local government areas, namely it's going to be in Ego local government, Oredo local government, Ikpobaoka, Ovia Northeast, and that's for the Edo Central. Then that's for Edo South. Then for Edo Central, we have Esan Northeast and Esan West. So these are the local governments that we have cases of the MPox. Local government that we have MPox cases. So presently, we're planning a vaccination in these 6 local government areas to ensure that we curb the spread of MPox in the state.
The state is preparing for MPox vaccination campaign, which is very critical because Edo State happens to be one of the states where we had outbreaks. For us in NAFDAC, being a very critical stakeholder, what I'm here today is to give confidence to people that the vaccine is safe. And you know, we always have vaccine hesitancy. People are scared that this vaccine will give problem or not. And going forward, the Pharmacovigilance Directorate is also organizing a cohort event monitoring. What do you mean by cohort event monitoring is for every person that is vaccinated, we'll obtain your consent and we'll have people that will be monitoring them calling them to follow up with any observation that they have.
From Justa, Benin City, Osamu Jame Kennedy, reporting from Afemai Reporters TV.